Hey, I'm Dr. Joe Niam, ToLoveThatFace.com. I'm a cosmetic facial surgeon in Richmond, Virginia. I do cosmetic facial surgery from here to here. I don't do boobs, bellies, or butts. Today we're going to talk about a procedure called the lip lift. And it's a neat little procedure that shortens the upper lip. So why would somebody want their upper lip shorter? As we age, as you know, things on our face droop and we get more fat deposits and our skin becomes loose, and our upper lip frequently can become longer. Now, some people are born with this, some people it is an effect of aging, and probably for most people. So when an attractive female has their mouth just a little bit open, you should see several millimeters of teeth, and probably the same with the male. With a big smile, you should see several millimeters of gum tissue, okay? And that's a normal smile. So for people that have a long lip, when they open their mouth halfway, you don't see any of their teeth. And when they smile, you just see a little bit of their teeth, okay? So by shortening their lip, you're going to see more tooth at rest, and you're going to see more tooth structure and a little bit of gum when they smile, and that's making it normal. In addition, this procedure not only shortens your lip from here to here, but it actually rolls the lip out and gives you a fuller, more pronounced lip. So it shortens the lip, it makes the lip, gives the lip more pout, and it's just a neat little procedure. It probably takes about 45 minutes to do this procedure. We do it with sedation. And it can be done as a freestanding procedure, but so frequently we combine it with facelift surgery or facial implants or eyelid surgery, other procedures where it's kind of an add-on. And a lot of people just don't realize that they have this option. So I'm going to show you some actual surgical footage. So if you get queasy, then you might not want to watch that part. And then I'll show you some actual before and after pictures. So who's a candidate for lip lift? Anyone who is not showing normal tooth structure at smile, okay, and at rest. And it's usually older patients, but sometimes younger patients have this same situation. Now, there are some instances where patients aren't a candidate, and those are people that have already show too much tooth or too much gum. If you shorten their lip, then it's not going to look good because they're going to be showing excessive tooth structure or gum. But you can reach out to us at LoveThatFace.com or info@LoveThatFace.com. I'm happy to look at pictures and discuss your being a candidate for this procedure. So sit back, we're going to watch some surgical footage and look at some before and after pictures. So we're marking the patient, and this is a very intricate marking. This is much like eyelid surgery, that you have to have very, very exacting measurements here. And it has to adapt to the very fine anatomy under the nose and on the side of the nose. So it kind of looks like bull horns or a mustache or angel wings. And when we remove that segment of skin, it's going to make the lip shorter and turn it out. So I'm using the Sonoquence radio wave surgery microneedle, and this is a bloodless incision. This is an area that really bleeds a lot if you use a scalpel. So I oftentimes will use the Sonoquence radio wave microneedle, and you can see it's a relatively bloodless procedure, and the less bleeding you have, the better your result is going to be. The easier it is to do the surgery, the less bruising and less discomfort. So I like using this modality for my incision. And it's also easy because the lip is mobile, and when you use a scalpel, it tends to push it around. Now I'm using the Sonoquence radio wave forceps, bipolar forceps, and you can use a scalpel, scissors, laser. I use various instruments at various times, but again, this is bloodless. You can see there's very, very little blood here, and when you do have a little bleeding, you can cauterize it. And then I'm undermining the tissue a little bit here in a bloodless manner. And I'll also will take a scissor and undermine this a little bit. And this undermining is what helps roll the lip out and give more lip pout. I'm putting in the deep sutures. These are dissolvable sutures, and these bring everything into an alignment with this intricate anatomy. And again, it's so important to line everything up perfectly when you do this procedure. And then the final sutures are a combination of dissolvable and non-dissolvable sutures that we would remove at 1 week. And that's the finished lip lift. And if you look at the teeth, you can see that the patient's now showing teeth. So now we're going to take a look at some pictures. Look at the long lip on the left and the shorter lip on the after picture. Same patient. You can see her lip is much longer on the left, much shorter and more pout on the right side. This is another picture, and you can see no teeth showing at rest on the left and appropriate teeth showing at right. Her smile is much better. She shows much more teeth with that shorter lip. Here's another patient, no teeth showing on the left, and after the lip lift with the shorter lip, you can see that the patient has a shorter lip and better tooth show. And you can see the lip is shorter in general and more attractive for more pout. Here's a patient, again, long lift on the left, shorter lift on the right. The same patient, you can see how much we've shortened her lip and her tooth show that she has now. And the long lip on the left, the short lip on the right. Same thing with this patient, another patient. You can see how we've shortened her lip and it's more attractive. You can see the amount of skin we removed, and this is the previous patient. This patient, again, shorter lip after surgery. You can see long lip on the left, short lip on the right. And you can also see the pout and the better lip formation that the patient has after surgery. This is the amount of skin that we removed from that patient. Another patient, you can see the straight long lip, and now it's shorter and has more pout. The patient hardly showed any teeth at smile. Now she shows a better amount, and we would probably go back and laser this scar as well. This is how much skin was removed on that patient. Another case, again, a really long lip, making it shorter and giving it some pout on this patient. So you can see what a lip lift does. I hope you've enjoyed this. If we can help you with any cosmetic facial surgery, reach out to me, info@lovethatface.com. I'm Dr. Joe Nyamtu. Have a great day.